Hi, I'm Dr. Tonya Cooksey, Director of Veterinary Relations here at AnimalBiome Veterinary. I would like to welcome you to the first module of our self-paced Lunch and Learn course. So what we'll be discussing today is who we are as AnimalBiome Veterinary, what the microbiome is, especially the gut microbiome, and why it's so important, the three types of dysbiosis that can occur in the gut, and then later in our second course, you'll be able to learn about our best practices when using our products. So to give you an idea of our team, we are a small but mighty veterinary team. Overall, we are a startup that was started in 2016 by our founder and her husband, Holly Gans and Carlton Osborne, when they had a dog who was suffering from chronic neuropathy that was just non-responsive to typical therapies. Being a microbiologist, Holly researched and looked into other causes that could be occurring and other ways that we could really help facilitate gut health. Our company is small with about 67 employees, and most of our employees come from the research and science department. So speaking of our research and development, we typically have about 6 to 8 peer-reviewed papers that are released every year. A third of our team, like I said before, is pretty much in our research department, and we work with both companies and universities looking at microbiome health. So let's start simple. What exactly is a microbiome? Well, overall, microbiomes are everywhere, but today we're really going to focus on the gut. So a microbiome, by definition, is a diverse collection of microscopic organisms that share our living space and our bodies. The gut microbiome, on the other hand, this is the community of microorganisms contained within the intestines. Now, even though we're going to focus on the bacteria when we talk about the gut microbiome, do be aware that the gut microbiome also contains protozoa, viruses, fungi, algae. All of these microscopic creatures make up our gut microbiome. However, bacteria make up the largest portion, and they have the most influence on everything that goes on inside the gut. So when I mentioned gut dysbiosis is basically an imbalance in the gut microbial community that's associated with some sort of disease. So it has been found that there are over 100 trillion microorganisms found within the gut of an individual. How do those microorganisms get there? Well, typically we do not obtain a gut microbiome until we are born. This goes for ourselves as well as our companion pets. We have to obtain those outside sources of microbiota coming from the environment, coming from our mother. So when you think about a lot of breeds that maybe have a lot of C-sections, you're probably thinking of one of two right now. Let's pick on the poor Frenchies. So Frenchies are one of those breeds that over the past 2 or 3 decades, we've really had to focus on doing cesarean sections because they just can't fit through the vaginal canal. So when we think about how they're introduced into the world compared to, say, a lab puppy, the lab puppy will pass through mom's vaginal canal. Mom will lick and chew open the amniotic sac unless it's already been opened. From there, mom continues to clean the puppy with her mouth. We get introduced to mom's oral microbiome. Then the puppy can easily latch onto mom in order to actually suckle for the first time. So now that little puppy is ingesting mom's skin microbiome as well as the bacteria that's found in her colostrum. Now let's compare that to our poor Frenchie. The Frenchie is removed from the uterus in a sterile environment. We are first introduced to, hopefully, a towel held by a technician that's going to rub that puppy and stimulate that puppy. So now we're already looking at outside sources of common environmental bacteria from that towel that are being introduced to that puppy. From there, maybe we are blowing on them, kissing on them because they're so cute. So there's your human oral microbiome. Maybe this pup can't nurse on mom just yet. She's having a rough recovery. So we need to either tube feed or bottle feed. Well, then we're looking at whatever environmental bacteria is located on that tube that's being introduced into that gut as well. So when we're looking at these sorts of situations, this isn't the natural microbiome that helps overall immunity in our Frenchie puppies. It's all outside influences. So that is a huge factor when we think about how all these bacteria get into the guts of our patients. So what all does the microbiome do? Well, metabolism is a big thing. We break down host nutrients and actually break down drugs. So, drug metabolism can be tied to how active and how healthy the gut is. We help improve mucosal barrier integrity. We also have take part in immunoglobulin regulation, and we protect against certain pathogens that might try to actually impact the gut. So, what influences the gut microbiome? Well, we've already kind of talked about genetics and the mode of delivery and how that makes a difference. Age is another huge factor. As we age and as our pets age, we do start to naturally lose diversity within our gut microbiome. The sex of the patient can make a difference. Due to hormonal differences, we can see changes within the microbiome of an intact versus a neutered patient. The environment the patient has. Was it a puppy that unfortunately came from a puppy mill? Its gut microbiome is going to be a lot different than a puppy that was raised in a different environment. Comorbidity. Sicknesses really do impact everything. So we do see changes within the gut microbiome based on what type of illnesses a patient has. And the last two have asterisks by them as influences because they are really big influences on the gut. Nutrition, honestly, is the main driving factor when we're looking at the health of the gut microbiome. Without the proper diet, the gut bacteria will not flourish and thrive like they should. And when it comes to medications, a lot of common medications we use in veterinary medicine can also impact the gut. Antibiotics, of course, is the big one, but we're now in an era of antimicrobial stewardship. So we're thinking more about how the antibiotics are not only treating what we need to treat, but how are they influencing other parts of the body, like the gut microbiome. Protein pump inhibitors, great for those nauseous patients, but they also influence the pH within the gut, so therefore it causes changes within the gut microbiome. And when we see these changes within the gut microbiome, we see them as clinical symptoms. And they're going to be some of the really common clinical symptoms you see in practice: vomiting and diarrhea, stress and anxiety, the poor itchy patient. Heart disease has been linked to imbalances within the gut, as has chronic inflammation, a compromised immune system, and weight loss and obesity. This is a survey of veterinarians in 2022 that looked at what type of sick patients are we typically seeing on a daily basis in general practice. And honestly, most of those visits, you can probably guess off the top of your head. They were either going to be itchy skin or diarrhea. And we do have really good products on the market right now that help with those symptoms and help get some temporary relief. But unfortunately, a lot of times we see these patients relapse and come back into the hospital with the same clinical symptoms once these sorts of treatments don't seem to make the cut anymore. So really, what we're going to be looking at when we talk about the gut microbiome is really focusing on a microbiome targeted approach to therapy. This approach looks at restoring the gut by introducing beneficial bacteria into the gut and help shift any issues of dysbiosis so that we can become a more balanced state, which overall will improve the gut barrier integrity. We're also going to support the gut with postbiotics. These postbiotics are basically inorganic metabolites that the bacteria produce, and they act on the immune system of that patient to keep them in a good health. And then the biggest factor, like I said before, is nutrition. So we want to make sure we feed the gut properly. We're going to feed those microbes so that they can produce the proper metabolites, which then will again influence overall health in those patients. So let's take a step back and talk about some of those key words I just mentioned. So prebiotics, probiotics, and postbiotics. Prebiotics are basically the fiber that we ingest in order to feed the living organism that is the probiotic. So probiotics come in a couple of ways. You can either have bacterial probiotics or you can have yeast-based probiotics. The probiotic, of course, like I said, is that living organism. Now, when that living organism, that's the probiotic, ingests the fiber, that's the prebiotic, they will produce postbiotics. And like I mentioned before, postbiotics are those basic byproducts that are created in that fermentation process that actually produce healthy benefits to our patients. So when we're talking probiotics, FMT is the gold standard of probiotics. FMT stands for fecal microbiota transplant. And this is a procedure that involves taking stool from a healthy donor and giving it to a sick recipient. By doing this, we're placing those native species-specific bacteria into the microbiome and making it complete. And this includes those metabolites that are really important, the postbiotics that are coming from the donor. When looking at FMT, in veterinary medicine, we did just recently release a consortium on the proper methods of testing donors, what to look for, how to administer. But the overall consensus is that we want a patient that is in good health, has a balanced microbiome, is free from parasites, pathogens, and infectious diseases. So another fun microbiome fact. During what century was microbiome medicine first documented as a therapy for common GI conditions? Well, it was 4th century China. A Chinese physician actually used a concept called yellow soup in order to improve diarrhea associated with food poisoning in patients. And so this yellow soup was him basically taking stool from a healthy adult individual, mixing it with a broth or water, and feeding it to the sick individual. And those sick individuals actually got better. So we're long past the era of yellow soup, but it's that same sort of concept of using FMT. We're taking those good, healthy bacteria, placing them into a gut that needs that bacteria, and then we're seeing the benefits from that. It wasn't until 2022 that the FDA actually approved FMT therapy as a standard of care for antibiotic-resistant C. diff infections.